is Dr. Centeno, and today I'd like to go over a C0-C1 facet joint effusion. Now, effusion in medicine is a term that means a swollen area, and it's usually used to talk about a joint. So this is a swollen facet joint. Now, the facet joints in your neck are small little joints about the size of your fingers, and they can get really irritated in patients with craniocervical instability. So let's look at the images here. This is C0, C1, C2, 0, 1, 2. And this is the left side of the patient. This is the right side of this patient. Now, we instantly notice some differences here. We've got the occiput here, which doesn't line up with the atlas on the left side, but on the patient's right side, they line up really well. So as we scroll through this left side here, we can see that there's a lot of this white stuff here, white stuff there, white stuff there. So there's white stuff here in the joint on the left. That's an effusion or swelling. Versus the right, as we scroll through this, we don't see nearly as much of that. Maybe it's a little bit here, but nothing like on this left side where we've got larger amounts of that white stuff. So I think what's happening here is this is a hypermobile patient. And on the left, we're seeing swelling within that joint. In fact, there's also swelling. You can see it here. If you compare the white stuff here versus there within the C1C2 joint. Now, I'm going to put up on the screen now what C0-C1 facet joint pain will produce as far as a headache is concerned. And so you can see that. So this is a patient with that kind of headache. Bottom line is, on the left side, there appears to be some dislocation happening of C0-C1. And on the right side, that's not happening nearly as much. On the left side, there's swelling within the joint. On the right side, not as much. So again, realize that this is not something that's going to be read out usually by the reading radiologist. They're usually not going to look at these images with this level of detail. So obviously we now have to get movement-based imaging to try to see why this is happening. Is there too much movement happening at C0-C1 and C1C2, and that's what's causing this? Then we would want to treat that instability, and we'd also want to treat this joint here at C0-C1 and C1C2. So thanks so much for watching. Have a great day.